Hello viewers, in the previous part of the video series of the human skeletal system, I have shown you the bones of lower limb. Now this is the fourth part of the 5-part video series of the human skeletal system, in which I will cover pelvic girdle and vertebral bones. First, I will talk about hip bone. It is also known as innominate bone, which is a large irregular bone. The innominate bone is made up of 3 parts: pubis, ischium and ilium. Pubis is the most forward facing bone out of the 3 bones. The left and right pubic bones are made up of superior ramus, inferior ramus and a body. Ischium forms the lower and back part of the hip bone, situated below the ilium and behind the pubis. The ilium is the uppermost and largest part of the hip bone. These 3 parts are joined together at a cup-shaped cavity called acetabulum. The 2 hip bones with their anastomosis with pubic symphysis, cartilage, and posterior sacral vertebrae forms the pelvic girdle. Now let's look at the individual parts of hip bone in detail. First, look at the pubis. It has a superior border called pubic crest. At the lateral end of pubic crest, there is pubic tubercle. The pubic tubercle may be palpated. It serves as a landmark for local anesthesia of the genital branch of genitofemoral nerve, which lies slightly lateral to the pubic tubercle. The pubic tubercle gives attachment to the conjoint tendon, the rectus abdominis, the abdominal external oblique muscle and the pyramidalis muscle. Pubis bone has the following parts: body, superior ramus and an inferior ramus. Superior border of superior ramus is called pectileal line. With the pubic crest, the pectileal line forms the pubic part of the arcuate line, as visualized here. The superior border of pubic symphysis, the pubic crest, pubic tubercle, pectineal line, arcuate line and sacral promontory of both sides together forms the pelvic inlet of true pelvic cavity. The pelvic inlet or superior aperture of the pelvis is a plane surface which determines the boundary between the pelvic cavity and the abdominal cavity. Pubic symphysis has importance in the field of forensic anthropology, as it can be used to estimate the age of adult skeletons. Obturator foramen is accompanied by the obturator nerve, artery and vein. In pelvis, obturator artery gives branches to urinary bladder, nutrient branch to ilium and pubis. Behind the pubis, it anastomosis with inferior epigastric artery. Obturator foramen is a larger oval opening which separates pubis and ischium as visualized in the video. Now this bone in posterior inferior part is ischium. It has a body and a ramus. As part of the hip joint, this bone plays a very important role in leg mobility, balance, standing up, lifting tasks. Clinically speaking, the ischium is associated with hip osteoarthritis. Ischium forms the posterior boundary of obturator foramen. Lower end of ischium forms ischial tuberosity. Ischial tuberosity is the lower part of the pelvis that is also known as sit bones since it helps to absorb your weight when you sit. However, it can also cause pain when a nearby fluid-filled sac called the ischial bursa becomes inflamed and causes ischial bursitis. The Istropic Ramus is a compound structure consisting of inferior pubic ramus and inferior ramus of the ischium. It forms the inferior border of the obturator foramen and serves as part of the origin of obturator internus and externus muscle. Also, most adductors originate at ischiopubic ramus. This concavity seen here is the lesser Shiatic notch. The lesser Shiatic notch forms a osteoligamentous foramen which provides communication of neurovascular structures between the pelvis, the perineum and the gluteal region. The lesser Shiatic foramen is separated from the greater Shiatic foramen above by the sacrospinous ligament. Superior to lesser Shiatic notch, there is a projection called as Ischial Spine. Above the ischial spine, you see a notch-shaped outline called the greater Shiatic notch. The notch holds the piriformis, the superior gluteal vein and artery, the superior gluteal nerve, the inferior gluteal vein and artery, the inferior gluteal nerve, the sciatic and posterior femoral cutaneous nerves, the internal pudendal artery and veins, and the nerves to the internal obturator and quadratus muscle. The ischial spines are the landmarks for pudendal blocks. The pudendal nerve arises from the ventral rami of S2, S3 and S4 and leaves the pelvis through the greater Shiatic foramen. Now we look at ilium. This expanded portion is called wing of ilium or ala of ilium, and this roughened area below the iliac crest is known as iliac diversity. It is elevated and rough and gives attachment to the posterior sacroiliac ligaments and origins to the sacrospinalis and multifidus muscle. Upper end of ilium is called the iliac crest as easily visualized in this video. The crest of the ilium is the superior border of the wing of ilium and the superior lateral margin of the greater pelvis. The iliac crest is the part of the pelvis and therefore its function is to stabilize the body by bearing the weight of the spine and upper body. Anterior end of iliac crest is called anterior superior iliac spine as seen here. It is a prominent landmark that is easily felt in living. The anterior superior iliac spine is a bony projection of the iliac bone and an important landmark of surface anatomy. It provides attachment for the inguinal ligament and the sartorius muscle. Here you can see iliopubic eminence. In the lower end, we have anterior inferior iliac spine. Now moving to the posterior aspect of hip bone, you can see the posterior inferior iliac spine forming the superior margin of greater Shiatic notch. Superior to the posterior inferior iliac spine is the posterior end of iliac crest called the posterior superior iliac spine. The posterior superior iliac spine gives attachment to the oblique portion of the posterior sacroiliac ligaments and the multifidus muscle. It is an important landmark in bone marrow aspiration. So I have completed anatomy of hip bone. Now I will be talking about sacrum and coccyx. This is the dorsal view of coccyx and sacrum. Coccyx is a triangular bone formed by fusion of four rudimentary coccygeal vertebrae. It is attached to the sacrum by a fibrocartilaginous joint, the sacrococcygeal symphysis, which permits limited movement between the sacrum and the coccyx. The function of sacrococcygeal mobility is to increase the antero-posterior diameter of the pelvis during labor and defecation. Despite its small size, the coccyx has several important functions. Along with being the insertion site for multiple muscles, ligaments, and tendons, it also serves as one leg of the tripod along with the ischial tuberosities that provides weight-bearing support to a person in the seated position. This is a sacrum. It is a large flat bone formed by fusion of 5 sacral vertebrae. These are transverse ridges of sacrum which mark the positions of the intervertebral discs between the bodies of the 5 sacral vertebrae in the immature bone. The sacrum is important because it forms a link between the spine and the iliac bones and also has an important part to play in hip stability. Sacrum is sexually dimorphic. It is shorter and wider in females than in males. This projecting anterior margin of sacrum is called sacral promontory. As mentioned previously, the sacral promontory is one of the boundary of the pelvic inlet. Extending my talk on the vertebrae of the human body, in a human vertebral column, there are normally 33 vertebrae. The upper 24 pre-sacral vertebrae are articulating and separated from each other by fibrocartilaginous intervertebral discs, and the lower 9 are fused in adults, 5 in the sacrum and 4 in the coccyx, or called the tailbone. The 24 pre-sacral vertebrae in adults are 5 lumbar, 12 thoracic, and 7 cervical vertebrae. Now, if you look at lumbar vertebrae, these are 5 in number, out of which 4 are typical and 5th is atypical. The atypical lumbar vertebrae is identified by its large size and absence of foramen in transverse process. Since these vertebrae are largely responsible for bearing the weight of the upper body and also permitting the movement, they are logically also the largest segment of the vertebral column. Now I will zoom in and show you the lumbar vertebrae in detail. A typical lumbar vertebrae has thin and tapering transverse process laterally. Since this is the 5th lumbar vertebrae and it comes within the atypical vertebrae, so you are not able to see any foramen in the transverse process. It has a pair of pedicle which are short and project backward. Vertebral foramen is present between body and the vertebral arch. There are two articular processes, superior articular process and the inferior articular process, which has superior and inferior articular facet respectively. This is the lamina which is directed posteriorly. In the most posterior part, we can visualize the spinous process. It gives attachment to posterior layer of lumbar fossa, interspinous and supraspinous ligaments. It also gives attachment to these muscles, that is, the erector spinae, multifidus and interspinous muscles. Now discussing about the 12 thoracic vertebrae present above the lumbar vertebrae. Thoracic vertebrae make up the thoracic spine. These vertebrae have very little motion because they are firmly attached to the ribs and sternum as shown in the video. They are intermediate in size between the cervical and lumbar vertebrae. The morphological features of a thoracic vertebrae is similar to typical lumbar vertebrae. They are distinguished from the lumbar vertebrae by the presence of facets on the sides of the body for articulation with the heads of the ribs, as well as facets on the transverse process of all except the 11th and 12th thoracic vertebrae for articulation with tubercles of the ribs. Above thoracic vertebrae, there are 7 cervical vertebrae. They can be readily distinguished from those of the thoracic or lumbar regions by the presence of a foramen in each transverse process, through which the vertebral artery, vertebral veins, and inferior cervical ganglia passes. Second cervical vertebrae is called axis. It is identified by the presence of dens or odontoid process. First cervical vertebrae is called as atlas. It is ring shaped and it has neither a body nor a spine. The cervical spine function is to provide mobility and stability to the head while connecting it to the relatively immobile thoracic spine. The movement of nodding the head takes place predominantly through flexion and extension at the joint between the atlas and the occipital bone, that is the atlanto-occipital joint. So viewers, I have finished the bones of pelvic girdle and vertebral column in this part 4 of the 5-part video series of human skeletal system. In the next and the last part of the video series, you will look at skull anatomy. Thanks for watching. Please like and subscribe to my channel.